Okay, so we'll get started now. So my name is Marla McGinnis. I will be your moderator. As I said, I've given each of you permission to record. If you are recording, please ensure you hit the record button on your own end as well. Please keep your video off and your mic muted unless you're asking a question. Dr. Strang will give some brief remarks, and then I'll cycle through the list of reporters to ensure each of you get one question and one follow-up. And if there's extra time at the end, I'll invite you to raise your hand if you have an additional question. Go ahead, Dr. Strang.
Thanks, Marla. Good afternoon, everybody, and thanks for joining for this update. I'll begin, as Marla said, with some short remarks, and then we'll open up for questions. I want to start by first offering my condolences to the family grieving the death of a loved one this week, a death due to COVID. It's a reminder of that we need to continue to take this disease seriously. Our case numbers do remain low, and the cases we have seen recently have been the two from HMCS Halifax, a cluster related to a family here in Central Zone, and also some other travel-related cases. We are not seeing any community spread anywhere in the province at this time. On the vaccination front, we still have more work to do on first doses, but we are seeing a steady progress. We are now at almost 56% of Nova Scotians fully or doubly vaccinated. And our goal is to have at least 75% of the population with 2 doses of vaccine by the end of August. Right now, we have about 200,000 appointments booked until the end of August. But within that, there are about 72,000 people who have had their first dose, but have not yet moved up their appointments for their second dose. If we want to move on to the next phase of our reopening, we need those people who haven't had either their first or second dose to get vaccinated as soon as they are able. And this is a good time to remind people who have had COVID-19 that they should COVID-19 infection, that they should still have 2 doses of vaccine. And this is because we don't know how long or how good protection from actual infection is. And that's consistent with recommendations being made from the National Advisory Committee on Immunization. So looking forward, as the number of people who need vaccination declines, we are planning to close the mass immunization clinics on August 15th. However, pharmacies will continue to do vaccinations throughout the rest of the summer and into the fall. We have seen some cases of inflammation or swelling of the heart in some people who have received mRNA vaccine. There have been 22 cases reported so far in Nova Scotia of this inflammation in the lining around the heart, which is called pericarditis, and or in the heart muscle itself, which is called myocarditis. Most of these cases happen within a week of getting the mRNA vaccine in people under 30 years of age, and it seems to be more common in males and after the second dose. And thankfully, cases have been relatively mild and respond well to conservative treatment and rest. And the symptoms to watch for are shortness of breath, chest pain, or the feeling of a rapid or abnormal heart rhythm. So we're asking people that if you get these symptoms soon after receiving an mRNA vaccine, you need to seek urgent medical attention. And I do need to say that we have included information on this. This safety signal has been emerging for several weeks. It's becoming clearer now, but we have had information on this in our informed consent process for a number of weeks. And this is not unique to Nova Scotia. Cases are being seen across the country and have been seen in the US and globally. The Public Health Agency of Canada is keeping a close eye on all adverse reactions. And there is no need to pause the use of mRNA vaccines because of this reaction. This is very different from the safety signal that occurred earlier this year with the AstraZeneca vaccine. That was proving fatal, but this is not the case with myocarditis and pericarditis. It's uncommon, and while the symptoms can be scary, people respond relatively quickly as I said, conservative treatment and rest. So my closing message is if you haven't had a first or second dose of the vaccine, it's time to get one now. There are thousands of appointments available across the province. And we ask the public to go to novascotia.ca/vaccinations and book your appointment now. Let's keep things moving ahead. And the sooner we get to our minimum target of 75% with 2 doses, the sooner we can continue with our reopening and move to phase 5, which allows the removal of restrictions and mandatory measures. And I'll end there.
Okay, thank you, Dr. Strang. So we'll begin with our question and follow-ups now. We'll start with Katie Hartai with CBC. Go ahead, Katie.
Thank you. Dr. Strang, are you worried about the lower vaccine rates among youth? And is the province considering vaccine incentives for this group or more broadly?
So we do have still some work to do in the younger age groups. We do continue to see progress. We're seeing anywhere from 1,000 or more people a day coming forward for first doses, and most of those are younger people. So we are making progress. We're not considering incentives. What we are doing is making sure that we have strong information and social media messaging, and making sure we have innovative and creative ways to have very easy access to the vaccine.
Do you have a follow-up, Katie?
Yes. If I'm looking for more information behind the decision to close community clinics, are you worried at all that reducing this accessibility might work as a deterrent?
No, I mean, if you look at the number of clinics that we have and what's going to be left in terms of pharmacies, and we're working with the Pharmacy Association. We have pharmacies in every community, almost every community across the province. And the pharmacies I know are working to make sure that they may not all be open all the time, but they're working to make sure that there is a pharmacy that's available within reasonable hours, 7 days a week in communities across the province. So as we move into, we've both first dose and second dose, we've immunized large numbers of people. Now is the time to be more targeted and focused, predominantly using our pharmacies. But we have lots of vaccine. We'll have lots of available appointments through the pharmacy. So I don't believe that's going to create accessibility issues. The other thing we have that we're using is we have mobile units through public health, and that we're using in specific communities when we feel we need to enhance access to vaccination. And we're also focusing on workplaces as well for accessing vaccines. So we'll still have, even though we're closing down the community clinics, they were good for a time-limited purpose of immunizing large numbers of people quickly. Now we can have more targeted and focused opportunities, but still making sure we have very good access across the province.
We'll go next to Natasha Pace with CTV. Go ahead, Natasha.
Thank you. I just wanted to check in, first of all, and see if you can say whether or not the individual, the woman in her 50s who passed away yesterday in the Central Zone, was in fact vaccinated.
We know from the information that individual was not immunized.
Go ahead with your follow-up, Natasha.
Thank you. I'm also wondering, with the return of events, in particular, the Halifax Wanderers are starting up again on August 2nd, and the Mooseheads are slated to start in October. Are you concerned at all that these large events could cause an increase or a surge in cases where there's so many people gathering?
So we have two things. Right now, we have limits on gatherings in phase 4. Those will be substantially modified when we reach phase 5, but we can't get to phase 5 until we have very high levels of 2-dose vaccination. And it's that 2-dose vaccination combined with continuing to have very low epidemiology that would allow us to have a much larger numbers of people together and doing that safely. We're still going to have protocols that facilitate people not coming if they're acutely ill. Good hand washing, increased cleaning. We may not have mandatory masking, but we'll certainly still be encouraging people to wear masks especially when they're indoors with large numbers of people around. And always, if we can't reverse the vaccination, we'll continue to. 75% is our minimum target. We'll continue to build that and make it as high as possible. But if our epidemiology changes, then we're hopeful it won't. But we will always be watching that and adjust our what's allowed in terms of large gatherings if necessary. But I certainly feel that if we can continue with low epidemiology and high vaccine coverage rates, because if you have a high 2-dose coverage, even if you do get an increase of disease, what you're going to have is really almost always mild to moderate disease, and you're still preventing severe disease.
We'll go to Jesse Thomas with Global next. Go ahead, Jesse.
Great, thank you. Dr. Strang, I just wanted to clarify on today's cases. You said one was related to HMCS Halifax. We know the Armed Forces has previously said there were 2 cases. Is this another case related to the ship, or is this just in fact getting caught up identifying the other case?
No, this is a third case related to that Navy vessel. So we're continuing to work, NSH Public Health, continuing to work very closely with our colleagues in the Canadian Navy around how we can respond and may need to modify our approach to the crew that were on that ship.
Go ahead with your follow-up, Jesse.
Great, thanks so much. I'm just wondering, I saw in the press handout that we're going to see less, going forward, no real media updates, or everything's going to kind of be on the COVID dashboard. I'm just wondering, with the state of emergency being renewed, what is your plan, Dr. Strang, to keep the public updated? Do you have a plan for the weeks ahead with your availability?
Yeah, we'll continue to communicate to Nova Scotians as we've always done through our website and through social media. That we'd been thinking for a few weeks that as our epidemiology stabilized and have robustly implemented our vaccine program, that we needed to move away from the regular briefings. Anyway, that there's other ways we continue to communicate with Nova Scotians. We'll do a weekly media release moving forward, and if there are significant issues that certainly I would be available in formats like this to speak to the media and through media to Nova Scotians.
So no more formal COVID briefings then?
At this time, there are no plans, but we don't know what where we're going to get once we get into September, etc. And there's a new government. There may be other decisions made, but for right now, we feel where we're at in terms of the pandemic, this is an appropriate level of media communication and communication to Nova Scotians, and we're no different. Every province is doing the same thing in terms of substantively walking back from the direct briefings, if you will.
We'll go next to Stuart Peddle with the Chronicle Herald. Go ahead, Stuart.
Thank you. Wondering about the Delta variant. I'd read that the Delta variant is expected to become the dominant variant in North America, I think. What is the plans for dealing with that? Is there anything special, or is it continuing as we go?
No, we know it's exact. The plan is, as we've been saying for weeks, that's why we need high 2-dose coverage, and we can't just be satisfied with a single dose. That it's the Delta variant, and there was a paper released in the last 24 hours confirming that there's good protection with 2 doses of vaccine against the Delta variant. Other than that, there's nothing special we need to do for the Delta variant, but again, it's a reminder of the need for high levels of vaccine coverage. Where we're seeing, whether it's in the weeks prior in Nova Scotia, where we have cases, and in other parts of North America and even globally, where there are substantive returns or increases in the Delta variant, it's in unimmunized or underimmunized populations. So that's why we need to focus on building a very strong wall of protection through as high a possible percentage of the population with 2 doses of vaccine.
You have a follow-up, Stuart?
Yes, I'd like to follow up about the relaxation of restrictions when we finally reach the critical number of vaccinations for the population, phase 5. What would that entail as far as relaxing things? And would that also include allowing more Canadians to come in without the need to self-isolate, perhaps, or would that entail a vaccine passport type deal?
So we haven't made final decisions, but I think it's safe to say that once we were able to get to that phase 5, what it means is that certainly with looking at reducing or even removing any border requirements for domestic travelers, international travelers, that's federal jurisdiction. It would also mean removing all, most, if not all, of the restrictions and mandatory measures, but continuing to support and promote many of the individual measures, such as increased hand washing, increased cleaning, keeping our social circles, being careful about our social circles, as I mentioned before, not mandatory, but certainly recommending masking in indoor places, especially when you're around other people. So you're really removing restrictions and removing the mandatory requirement, but still promoting lots of I'll call them behaviors that minimize the chance not for spreading not just COVID, but for influenza and a whole range of other both respiratory and gastrointestinal viruses and bacteria.
Let's go next to Michael Tutton with the Canadian Press. Go ahead, Michael.
Hi there. My name's Sarah, and I'm here for Michael. I wanted to ask: do we know why the myocarditis and pericarditis arises following these mRNA vaccines?
We don't know exactly. It's not been shown for sure that they're causally linked. Certainly, we're seeing stronger evidence of an increased, even though it's uncommon, an increased rate of myocarditis, pericarditis in that short period of time after receiving, especially the second dose of mRNA vaccines. It might well have something to do with kind of the immune response, but we don't know for sure, A, that it's causally related, or B, even if it is causally related, what the exact mechanism is.
Right. Okay. And then I also wanted to ask, with the lagging vaccination numbers among young people, is this a surprise to you, or did you expect to see lower numbers amongst this group?
So I don't think, they're lower than other age groups, but I think in Nova Scotia, we're actually doing much better than many other places. So I'm not sure I would use the word lagging. We still have some work to do with the younger age groups. Not surprising. We knew all along that we'd have to do more work for younger age groups who, especially who often tend to, you have to have different and stronger and innovative approaches around a whole range of health issues. But we still are, as I said earlier, we still have, again, more work to do, but we still have pretty good coverage in those younger age groups. We have to continue to increase it. And we are getting, as I said, 1,000 or more people a day for first dose, most of whom are in those younger age groups. So we'll get there. It's going to take a little bit more time, but every day we slowly inch forward in that first dose, and then we need to get them back for the second dose.
Thank you.
Thanks, Sarah. We'll go next to Chris Halef with News 95.7. Go ahead, Chris. Chris, are you there? Okay, we'll move on to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. The largest pool of unvaccinated people is, of course, the children under 11, under 12. There was a case in the U.S. of a 5-year-old dying with no symptoms previous. Are you still confident that opening up or doing away with restrictions among that group is safe?
So even though there are occasional cases of very severe disease, we know by and large that COVID produces relatively mild illness in the vast majority of younger people. We also don't have a vaccine for them, so it's a reason why we need everybody else who can get vaccinated to be vaccinated. I've said it many times, when you get vaccinated, you don't just protect yourself, you protect those around you who cannot be vaccinated, whether because of age or underlying health reasons. So, but again, we do know that it shouldn't make us complacent, but it does give us reassurance that the vast majority of COVID illness in children is mild.
How about your follow-up, Tim?
Yes. Do you have a thought about when the state of emergency may be lifted?
So that's not that's a decision made by others in government. That's not a decision that I've ever been involved in.
Okay, we will go next to Pat Healy with the Laker. Go ahead, Pat. Okay, we'll move on to Victoria Walton with the Coast. Go ahead, Victoria.
Hi, thank you. Dr. Strang, I'm wondering just about the numbers from yesterday, if you could clarify a bit. We stayed at 11 active cases, even though that death was reported yesterday, and there were no new cases reported. Is that because the death was a few weeks ago and we just discovered that it was COVID related recently, or something else?
That individual was ill several weeks ago. I don't know exactly when, and so they would have been considered resolved even if they were remained alive. And I'd have to go back and look at in detail. We also have, there could be other cases that had happened more recently, but had met the criteria for being resolved and therefore no longer an active case.
Go ahead with your follow-up, Victoria.
Thanks. And I'm wondering just about second dose rebooking. You said there are, I think, 72,000 people who haven't moved their dose up yet. I'm wondering if there will be maybe a second email prompting those people to reschedule, or if there's another way that we're trying to get those people to rebook.
Yeah, we're certainly looking at repeat emails. That my understanding from the vaccine team is that initial email had quite a response. We had about 10,000 people move their vaccine up. So we're looking at further emails as well, helping people to remind them and give them the rationale for moving up. We also are increasing the walk-in capacity in many of our vaccine locations. That makes it easier for people just to act on the spur of the moment, if you will. So we'll continue to pay attention to this because it's very important that we try to get as many people as possible to move their vaccination date up as far as they can.
We're going to try to give Chris Halef with News 95.7 a chance again. Chris, is your audio working now?
Can you guys hear me?
Yep.
Oh, okay, perfect. Not sure if you can answer this, Dr. Strang, but with the 22 cases of myocarditis and pericarditis, I'm wondering if you could say perhaps how many of those people received mixed doses, same doses. Is there a kind of a breakdown that you might have?
I don't have a breakdown between whether they were the same type of mRNA vaccine or mixed.
Go ahead with your follow-up, Chris.
Yeah, and as it stands right now, not all countries are accepting travelers who have had mixed vaccine doses like Pfizer and Moderna, and that includes many Nova Scotians. I'm just wondering if you could comment on that, and do you anticipate that thinking will change in the future?
So first of all, there's actually no scientific rationale behind that stance. I know that the Public Health Agency of Canada continues to have discussions at an international level around this issue and what the science would say. In the meantime, here in Nova Scotia, I recognize that it's creating issues for some people, but we are focusing our efforts on first and second dose vaccine. And if this remains an issue at some point in the future, we may be able to start offering third dose vaccines for people. But for now, we have to focus on first and second dose.
Okay, we'll go to Dave DeVoe with Coastal Radio next. Go ahead, Dave. Dave, are you there? Okay, we'll move on to Megan Groff with Halifax Today. Go ahead, Megan.
Yeah, you had said that there have been no fatalities associated with the rare event post-vaccination. Is that just here in Nova Scotia, or is this a broader base?
No, I don't. I'm not aware of I'm not aware of any fatalities in the national level. I don't know internationally, but what I can say is that it's very clear that from the international data to national and Nova Scotia, that the vast majority of people who have myocarditis, pericarditis, it's a significant proportion may need to be hospitalized, but they're almost always successfully treated with conservative therapy, which may mean some medications and rest essentially. So even though it's concerning, for people and we have to recognize this potential, that it almost always has a return, a short course, and then a return to full health.
Do you have a follow-up, Megan?
Yeah, are there any other long-term implications that people should be aware of with the heart inflammation?
No, everything we're seeing is people recover their heart, function. It's a time-limited impact, and they return to full health.
Okay, we'll go next to Jack Morris with Hot Country 103.5. Do you have a question, Jack?
I do. Dr. Strang, given the epidemiology where it is right now, are you at all concerned about the flurry of activity associated with the provincial election?
No, I think we've worked with Elections Nova Scotia for months, and so I think we have the right protocols in place, both for campaigning and then also for voting. As always, it's up to people to follow those and be aware of them and take the right steps to protect themselves.
Do you have a follow-up, Jack?
No, that's all for me. Thank you.
Great. And we'll go to Adam McNamara. Go ahead, Adam.
Thank you. Good afternoon, Dr. Strang. I'm just wondering about the concerning the myocarditis and the pericarditis you mentioned. I'm just wondering what kind of treatment these people are receiving. Is it modified treatment compared to what somebody that would develop this naturally, say?
No, I can't speak in detail of the treatment. I'm not a cardiologist, but what we do know is that essentially what we call conservative therapy, which would basically mean medication. They don't need any invasive procedures, etc., and time and rest. Seems to lead to a complete resolution of this. But although a significant proportion do require some period of time in hospitalization, but again, it is conservative therapy and time and rest.
Do you have a follow-up question, Adam?
I do, yes. Thank you. Are there any commonalities besides age that you guys are seeing with these AEFI effects?
Well, what we're seeing in Nova Scotia is actually very consistent with what's happening nationally around the world, that it's in the younger age group, it's mostly in 20 to 30-year-olds, males more than females, seems to be second dose more likely than first dose. So what we're seeing, and the clinical course, which I just outlined, for generally full recovery. So what we're seeing in Nova Scotia is actually very consistent with what's happening, being observed in other parts of the country and the world around these mRNA vaccines.
Thank you.
But let me make a comment though, but for anybody that the risk of remaining unimmunized far outweighs any risk from this uncommon and time-limited adverse event.
Thank
you. Okay, so those are all the reporters I had registered. If anybody does have an additional question, feel free to raise your hand and I'll call on you. Give it another minute or two. Jesse Thomas, go ahead.
Thank you, Dr. Strang. I just want to go back to the case related to the HMCS Halifax. Can you give us any update on what type of protocol they're having to follow now? Is there additional testing being done for all the crew members? And is this a case of a crew member, or is it someone related to the crew?
No, the third case is my understanding it's a crew member, and we have everybody else on the ship who have been sent home as identified as moderate risk contacts. They have to be isolated at home, and they're undergoing subsequent testing. They had a first test a few days at the beginning of the week before they left the ship, and then they're having a test around day 7, and then they get a test around day 12.
Great, and we'll go to Victoria Walton next.
Thanks. This question is about school reopenings, I guess, for the under 12 age group, specifically those younger students who aren't vaccinated. Is there a plan working with school boards or school authorities based around, increasing ventilation, in things for the fall and for those students who won't be vaccinated?
Yeah, we are working on a return to school plan, not just for the under 12s, for all ages, all classes, with the Department of Education, and we'll have more to say on that in the weeks ahead.
Great, and we'll go to Stuart Peddle next.
Hi, Dr. Strang, you mentioned the possibility of offering third dose to people if there are repeated concerns about traveling with a mixed dose. I'm wondering, in general, do you anticipate a need for a booster in the future?
We don't know about that. That's an unanswered question at this point in time based on the science. And there is work underway to look at the starting point where do people who are immune compromised and they need to get a third dose. And then there's also work underway to look at, is there a need for a booster dose? But that is unanswered, at this point in time. What we do know is that people who especially with 2 doses of an mRNA vaccine have very high levels of protection against not only against any type of illness, symptomatic illness, and even higher protection of severe disease and ending up in hospital. What we need to do is continue observing the clinical trials and to see how long does that immunity, how long is it sustained. And as my understanding, as we continue to look at the clinical trials, the high level of protection is being sustained, but we need more time for those clinical trials to go on before we can really answer the question that's at some point in time, is a booster dose needed?
Great. We have one last question from Katie Hartai. Go ahead, Katie.
Thanks for your time today, Dr. Strang. Has Nova Scotia received its delayed shipment of the Pfizer vaccine?
Yes, we've got all the vaccine that we're expecting to get. We have lots of vaccine to meet our needs of going beyond that target of 75% of the population getting 2 doses of vaccine. So vaccine supply is not an issue at this point in time.
Great, thanks very much, everybody. We'll conclude there. Thanks for your time, Dr. Strang, and have a good rest of your day, everyone.